Well, the recent surge of COVID-19 cases in Florida due to the Delta variant has caused a rise in hospital cases across the state. Dr. Jason Wilson is the Associate Director of the Adult Emergency Department at Tampa General Hospital, and he joins us now. Dr. Wilson, welcome back.
Thanks for having me, Rob. I think I'm going to keep on coming back until we get these vaccine numbers up a bit, though.
Yeah, I so wish we could talk about something else. Okay, so Florida's seeing a new surge in coronavirus cases. What's the situation now at Tampa General? Are you seeing more and more unvaccinated people being admitted?
Yeah, over the last 2 weeks, we've seen a pretty rapid change in our COVID hospitalizations and the types of patients being hospitalized for COVID. We've seen really that Delta variant start to take over the predominant type of genetic sequence we see for the COVID-infected patients. And again, the majority of the patients that we're seeing get admitted to the hospital are not vaccinated. First of all, it's less likely to be admitted to the hospital if you are vaccinated. It's about 8 to 2 unvaccinated people versus vaccinated people being admitted. And then of those that are admitted, to be sick enough to need the ICU or to be put onto a ventilator, it's about 9 to 1. Unvaccinated patients to vaccinated patients. Our numbers themselves have gone up by about 4.5 times where we were just 10 or 12 days ago. 10 to 15 people in the hospital at any given time with COVID 2 weeks ago. Now 80 to 90 people in the hospital with COVID.
All right. The CDC is out with a report on Friday saying that vaccinated people are shedding the virus at the same rate as unvaccinated people. And so I want to ask you, what does that mean to you, and what does that say about masks?
Yeah, this was a concerning report that came out from the CDC, really around an outbreak that sort of happened in Massachusetts with a high number of patients who were vaccinated. But what was found within that data was that the patients who were vaccinated still had pretty high levels of the Delta variant. So even though they may not have had symptoms, they still had high levels of Delta variant. What that means is that those virus numbers are high in their bodies. And so any action, coughing, talking, sneezing, could spread virus very easily. And that means in a place like we are right now in the Tampa area in Florida, where a large number of people are unvaccinated, even if I'm vaccinated, get COVID, feel no symptoms, but cough, sneeze, and have Delta variant, I can easily spread that to other people, definitely those non-vaccinated patients or people. And that's what really led the CDC to make this change in the recommendation around mask wearing with vaccinated people, because even if I'm vaccinated, have COVID, Delta variant, don't know I have that variant, cough or sneeze, I could spread that variant easily, hence the mask change.
So masks are still important. Some politicians are saying that this spike that we're seeing now is seasonal. Is it seasonal?
Well, here's the one thing we know a year and a half into this. Where we saw hospitalizations and deaths drop drastically was when we saw vaccines become widely available. The other thing that we've seen as well is we've seen surges and spikes in different time periods. In winter, in summer, in spring, we've seen spikes now with the COVID virus. What we've seen change things is vaccination. What leads to these spikes are large numbers of unvaccinated people and variants like the Delta variant. These variants can arise with the risk factor being not being vaccinated. That's how these variants sort of arise over time.
So how close do you think we are to achieving herd immunity?
Well, right now in Florida, we're really stuck around that 50% mark for vaccination. And, herd immunity is a theoretical mathematical concept built around vaccines and built around how many people do you need to get vaccinated given a certain virus and its transmissibility. And we've sort of estimated that number to be, it depends on who you ask, but somewhere in that 70% range. Certainly we'd be much better off in that 70% range than we are in this 50% range we're stuck in now. The data we're seeing clinically is backing that up because we've seen a shift of older patients being the predominant people with COVID to younger patients now being the predominant people with COVID. And what I mean by that is our older population here in Florida has actually done a pretty good job of getting vaccinated. Some counties, those numbers close to 90% of elderly individuals having both doses of vaccine, really not seeing high spread of COVID. So I'm not sure we've hit herd immunity per se, but we've certainly hit a level of immunity in that population where we've got good protection.
Well, Dr. Wilson, thanks a lot. Thanks for coming back. It's always great to see you. And I wish we were talking about something else.
Yeah, maybe different circumstances next time, Rob, but great to see you too. Thanks for having me.